When Sister Monica Heron strolls the grounds of Riverbend Hospital in Eugene, she marvels at how much has changed and how much has stayed the same.
The mission is to carry on the healing ministry of Jesus Christ and to treat each person in a loving and caring way.
It's a mission, she says, that remained constant throughout her 50 years at Sacred Heart Medical Center. Before retirement, Sister Monica advanced a legacy of compassionate health care, first delivered to this community in 1936 by the Sisters of St. Joseph of Newark. Since then, Sacred Heart Medical Center has expanded to meet the needs of the region, supported by generous donations, and reflected most recently in the construction of Riverbend Hospital, an award-winning, state-of-the-art medical facility built in one of the most beautiful settings in the United States, a setting chosen to promote healing.
I sometimes think that it must be soothing for people who have relatives, friends, their loved ones in the ICU, or very sick in the hospital, or even dying, to take a little stroll and get renewed by the river must be good. People, though, are what make the care most important. Their competency, their caring, their respect, their love. A patient feels that, and it helps them get better.
Rob Blair would agree. He's walked this path around Riverbend many times during his daughter's 74-day stay. Ava, born 3 months premature, was admitted to the neonatal ward at birth, where she remained while Rob's wife, Linda, battled breast cancer.
There was no guarantees that Ava would make it. So it was just a very tough time for us.
I was terrified. The NICU nurse came in and she kissed me on the forehead and she said, don't worry. She said, we get to have you here and we're going to take wonderful care of your baby.
When you're going through something like what we went through, where the odds are stacked in a certain way and it's a very tough, you're going through some very tough things. For Riverbend to be an embracing, warm environment and the nurses and the people to be warm and caring, that, to me, helped improve our outcome.
Ava, now 5, is healthy and strong and often visits her NICU nurses.
Hi, I can actually stand up. Good to see you.
And it's good to see you again, Punky. How are you getting so big?
Linda, currently cancer-free, regards the nurses as family.
We had a very good ending because we had very good care.
Our families in NICU have a very difficult journey. I think that the staff tries, through getting to know in our long-term care, to really figure out what's going to make this the best experience for each family, and then to try to support them.
We have done special things for different circumstances. I've taken a baby to a baby shower with the mom on the cancer ward because the baby was still in NICU, and I've taken a baby up onto the oncology floor for a grandpa to hold the baby before he died. And, you know, those are the kind of things that we strive to do for all the families.
Right over here.
It's a unique convergence, a hospital system where compassionate care meets medical excellence through a staff that embodies both.
Sacred Heart Medical Center has had a strong commitment to serving the community for over 125 years, and we are so blessed to have caregivers, namely physicians and nurses, who have served the poor and the vulnerable as well as those that could afford the highest level of health care within our community.
Health care provided at 2 campuses in the Eugene-Springfield area, serving nearly 150,000 people each year.
The Riverbend campus is really dedicated to caring for the sickest members of our community, and so we offer everything from primary care services, urgent care, and everything in between, really with a dedication to the patient and the family experience. When you think about the University District campus, it's a complement. But that campus is also dedicated to the members of our community who suffer from mental illness, and also for those elderly patients that might need a more caring environment that's catered and specific to our elderly population within the community.
Together, the hospitals offer a broad range of innovative services and world-renowned specialists, utilizing cutting-edge technologies and protocols that are today attracting attention around the country.
I have to say that we are at the leading edge of neurosurgery here, and it has evolved into a world-class program with endovascular neurosurgeons that are here 24/7 taking care of all of the brain disorders, not just for Eugene Springfield, but for a multi-county area. What's important to appreciate about River Bend is that we have the infrastructure and the facilities to really accomplish any medical goal. It's a very exciting time to be us.
The other wonderful thing about being here at River Bend is our CTO program. So CTO stands for chronic total occlusion. They're arteries that have been closed for a really long time, and so much so that they're almost concrete. For a long time, people didn't even think of opening these because it was such a laborious effort, but over the last 10 years, the landscape has changed. We are one of very few centers in the country that offer this procedure.
Couple deep breaths for me.
Before I started, I realized the potential for the things I could do here, and it'd be very different from other places. It's almost like a little jewel of academic superiority in the middle of Oregon.
Just over the last several years, we've been able to become engaged as a research center through the National Institute of Mental Health. And we have a program that immerses a behavioral health professional in the primary care setting, so that when a patient expresses how hopeless they feel about needing to lose that 40 pounds, needing to stop smoking, feeling their diabetes is out of control, they're able to go meet with the person, come up with a plan of care. So what we see every single day are people returning to their lives and be productive citizens again, which is what everyone really wants ultimately.
We created a world-class healthcare system here in this community. The technology, the level of care that we provide really has its genesis in generous community members who took money out of their own wallets and invested it into a hospital, into a healthcare system that they would receive care from.
Donor support has been the lifeblood of this healthcare system for 75 years, enabling excellence, inspiring innovation, and saving lives. Doctors, patients, and families depend upon community giving, contributions that make Sacred Heart Medical Center what it is today and will determine what it will be tomorrow.
Well, I just say God bless everyone who's associated with Sacred Heart, and I hope that the mission inspires you, and we are relying on you to carry it out.